With over 100 million people infected and over 2 million deaths, the COVID-19 pandemic has impacted the lives of almost everyone on Earth. As people yearn for a sense of relative normalcy, concerns are mounting over the increasing public skepticism, apathy, and even hostility to the most promising solution to control the pandemic, the vaccine. Vaccines save lives. They have achieved complete or near-complete eradication of diseases, such as measles and smallpox that were once thought impossible to beat. Based on evidence from clinical trials, the Pfizer-BioNTech vaccine was 95% effective at preventing COVID-19 illness in people, and the Moderna vaccine, 94% effective. Despite this, a recent nationally representative U.S. study found that people's self-reported intent of getting a COVID-19 vaccine declined from 74% in early April to 56% in early December 2020. About 2 in 10 Americans are certain they will not change their mind about refusing the vaccine, according to data from the Pew Research Center. These data are alarming, as even the most effective vaccines will not end the pandemic if not enough people take them. It is tempting to dismiss those who refuse the vaccine as conspiracy theorists. As I explained in an earlier post, misinformation around the vaccine remains a critical threat that we must tackle head-on. However, conspiracy theorists and anti-vaxxers are not the only groups who are hesitant. Even among those who consider COVID a real concern, mistrust in the vaccine itself, from its development and testing to its distribution, along with inconsistent messages from the government, has decreased intentions to take the vaccine. Guinea pigs, skepticism in underrepresented communities. While vaccine refusal is usually most prevalent in wealthy, white communities, hesitancy rates for COVID vaccines appear to follow a different demographic pattern. Repeated studies show that marginalized ethnic minority populations are most at risk of infection and death from COVID, yet they are also the least likely to report that they plan to be vaccinated. There's a logic to this refusal. In medicine, not everyone is treated with the same standard of care. Historical examples of Black Americans being mistreated, neglected, and even abused by the medical establishment loom large in the minds of many. For example, behind the Black community's wariness of the COVID vaccine is the lingering legacy of the 1932 U.S. Public Health Service Syphilis Study at Tuskegee, in which hundreds of Black men, some with syphilis and some without, were intentionally misled about the study's purpose and did not receive treatment for their syphilis even after penicillin became widely used to cure the disease. Differences in medical treatment by race are not relegated to the past. In present times, Black newborns die at 3 times the rate of white newborns. A study published last September examining 1.8 million U.S.